Hi everyone, this is Alyssa Chenault, and I'd like to thank you for joining us tonight for this webinar that will give you an update on what's happening in Ohio with Medicaid expansion. Medicaid provides comprehensive health coverage, and the expansion proposed by Governor Kasich will provide coverage for over 275,000 Ohioans, many for the first time. This webinar is being hosted by Ohio Consumers for Health Coverage, which is a broad-based coalition that unites the consumer voice with the goal of achieving affordable, high-quality health care for all. Ohio Consumers for Health Coverage is staffed by UCAN Ohio, and you can visit either of our websites at ohioconsumersforhealth.org or ucanohio.org. So just a couple of housekeeping things. If you have any questions right now or at any point during the webinar, please submit them in the questions box on the right-hand side of the toolbar. If you don't see the toolbar, you can click a little red arrow on the top of the page to expand and to minimize the toolbar. Submit questions as they come to you, and there's really no such thing as a dumb question, so feel free to type anything you want in there. And this will just ensure that we have a buildup of questions to answer when it comes time for question and answer. And then if you're having any technical difficulties with the webinar service, but you can hear us over the phone, you can access a copy of the PowerPoint on our website at ohioconsumersforhealth.org. It's right on our homepage. And I also will be emailing a copy of the PowerPoint up in a follow-up email tomorrow. So tonight you will hear from Kathleen Geminer, Project Director from Ohio Consumers for Health Coverage.
Hello, everyone.
You will also hear from Deb Steele, Statewide Advocacy Coordinator at UCAN Ohio.
Good evening, everybody.
And then, as I said, I'm Alyssa Chenault, Communications Manager here at UCAN Ohio, and I'll be moderating and assisting with this webinar today. We also have some great guests that are joining us tonight. Tonight you will also hear from Senator Capri Cafaro.
Hi, good evening, everyone. Thanks for joining us.
And she caught wind of this webinar and was really thrilled about the opportunity to share information about a piece of legislation she recently proposed. And we'll be talking more about that legislation a little bit on in this webinar. We also wanted to thank her for reaching out to us about participating in this. And since we're a nonpartisan organization, we also reached out to her Republican colleagues in the House and Senate, but unfortunately their schedules didn't allow them to participate, but they were excited about the opportunity to present on this as well. Tonight we also have Reverend Tim Ahrens.
Hi there.
And he's Senior Minister at First Congregational Church, United Church of Christ here in Columbus, Ohio. He's also co-chair of We Believe Ohio and co-president of B.R.E.A.D, which stands for Building Responsibility, Equality, and Dignity. He's really worked tirelessly on this issue, and we're really thankful for all he's done and for being on this webinar today. And so with that said, I'd like to turn it over to Reverend Ahrens, who's going to share his perspective on the decision to expand Medicaid in Ohio. Reverend Ahrens?
Hi, everybody. Alyssa, I have to laugh because I don't know how many times when I've dealt with issues that cross over into the State House, I'm introduced as the pastor of First Congregational Church. It's congregational, so it may seem like I spend all my time in the Congress, but it's mostly at First Congregational. So it's good to be with you all tonight. I've been asked to sort of speak on a couple of things. First of all, give a little bit of background on what I've done on this issue, and also some of the needs that I perceive we have at this particular point, how I feel stuff where we are at this point hasn't gotten it done yet, and finally some steps for action. And of course I speak out of my faith perspective as a pastor in a church. I have been with this issue for a long time, but in December we really looked at the possibility of expanding Medicaid, and it looked like, one of these kinds of things that was an all-rounder. Everybody would get on board. The governor added his voice in February. He gave this powerful speech about getting on board with Medicaid expansion, and we thought this is going to happen. We went through lobby days. We went through testimonies. I've spoken to any number of senators and legislators, representatives. The B.R.E.A.D organization got on board. 52 congregations, 45,000 people, and I have never seen a coalition wider and more far-reaching of advocacy groups, of church groups, of synagogues, and people from mosques becoming involved, marching, testifying, speaking. I've done it all on this. So I find myself sitting here on August the 13th saying, how has this not gotten done? And, it mystifies me. And the only thing I can think of is that the needed ingredient to get this done is courage. It takes courage for the legislators sometimes to do the right thing. And maybe we're the ones to approach the cowardly lion, if you will, and offer courage to them. I think it also takes faith to get this done. You have to have faith in people. You have to have faith that this program will work, and that you're going to hear the case made by a number of others. But I feel like a lack of faith, a lack of courage has not gotten this done. I've heard legislators say any number of times, well, the votes aren't there. And I looked in the eyes of senators and said, the votes aren't there because your vote's not there, and you say you're for it, but you're not really doing anything. And so I think it's going to take a whole new approach. So I'm looking forward to the action plan presented tonight, and for you as people who are weighing in on this tonight, to take this to your religious leaders as well as going to the legislators. You got to sit down with your pastor. You got to sit down with your rabbi, with your priest, and convince them and compel them to get involved too. It takes courage for them. There's a story, and I'll end with this, that when Moses got to the Red Sea, it's an apocryphal story coming out of Judaism. When he got to the Red Sea, Pharaoh's hoofbeats of his army on the tail of the people of Israel, they couldn't cross the sea. And he put his staff in the sea and called forth, God's power upon that sea. It didn't happen. And it wasn't until a child stepped into the sea that the seas parted. It takes some extraordinary steps by people of faith, and that's what we're looking for tonight, that you would step forward in faith. So I encourage you tonight, and I look forward to hearing as the evening goes on how this will unfold. Thank you.
Great. Thanks, Reverend Ahrens, for really all you've done and all you'll continue to do to make sure Medicaid expansion becomes a reality here in Ohio.
Thank you.
So let's just do a quick overview of what we're going to cover tonight. We're going to go over a background on Medicaid expansion, what the benefits are, who supports and opposes the expansion, the status of Medicaid expansion in Ohio. Then we're also going to cover proposed legislation, and that's where Senator Cafaro is going to speak on her piece of legislation. We're also going to talk about the other pieces of legislation being proposed. Then we're going to go into the consequences of not expanding Medicaid. And then finally, Deb Seal is going to talk about what actions you can take to help make Medicaid expansion a reality in Ohio. So the first thing we're going to do is take a quick poll question that tests your knowledge about eligibility for Medicaid in Ohio. The first question we have tonight is, who is currently not eligible for Medicaid in Ohio? And I'm going to launch the poll. And if you're viewing this webinar via your computer, you're able to click one of the choices, and the choices are children and pregnant women under 200% of the federal poverty line, parents under 90% of the federal poverty line, persons with established disabilities, and the last option is adults with no dependent children in their household under the poverty line. So just click which one you think is not currently eligible for Medicaid in Ohio. Give you a couple more seconds to put in your answer before I close the poll and share the results. All right, thanks for taking that. I'll share the results with everyone. So pretty much everyone got it right, 100%. Great job, everyone. It means you're really knowledgeable about the issue. All right, and with that, we're going to turn it over to Kathleen. And she's going to start us off talking about what is Medicaid.
Okay. Alyssa, I'm not seeing the next slide here. Oh, thank you. This is Kathleen Geminer. I'm happy to be with you tonight. Medicaid is a comprehensive federal state program in providing health coverage. That means that the dollars that pay for the Medicaid program come both from the federal government and the state government. The state administers the Medicaid program. And as you all seem to know very well, right now Medicaid covers only certain categories of people: children, pregnant women, parents with incomes under 90% of the poverty level, people who have an established disability, basically that meets the Social Security test, and older adults that are needing long-term care. It also Medicaid also supplements Medicare for many what they call dually eligible persons over 65. You can advance the slide.
Yes.
Okay. Basically, expansion of Medicaid is one of the ways that the Affordable Care Act expands coverage. Under the Medicaid expansion in the Affordable Care Act, all adults under age 65 whose income is under 138% of the federal poverty level become newly eligible for Medicaid. You can advance?
Yes, I understand.
Looks like someone needs to mute their phone. So anyway, one of the problem that has happened since the Affordable Care Act was passed is that the Supreme Court determined that while it was appropriate that Medicaid be expanded in the Affordable Care Act, the penalty that was applied to the states, that is that if they didn't do it, they would lose all their Medicaid funding, could not be imposed. And while the law wasn't actually changed to make it optional, basically as a point of fact, it became optional because the states couldn't be penalized. Therefore, they treat it as optional, and we've had to go one by one across the country to get the states to cover, to provide extended Medicaid to their population. You can advance the slide. So who would be covered? Well, basically, it's people under 138% of the federal poverty level. And so if the family size is 1, that's an annual income of $15,856 in 2013. When we get to about February next year, we'll see that that federal poverty level will probably climb up a little bit. Monthly, that's about $1,322, and hourly, that's about $7.62 if a person is working a 40-hour week. So you can also look at this chart and see how it climbs. So when we get up to a family of 6, they, if their income was $43,594 a year, they would qualify for Medicaid. And we have to remember this is for folks under the age of 65. So this is 275,000 Ohioans in the next 2 years that could come on to Medicaid if the state would expand Medicaid. Now, who pays for Medicaid currently? Well, if you look at the first column, you'll see that for the most part, right now, 2013, the federal government is picking up 63 cents out of every dollar, and Ohio picks up 36 cents out of every Medicaid dollar. That's a pretty good deal. If you look back at 2009, 2010, you'll see that it was even higher, but that was because there was a special one-time expansion of the Medicaid match rate, and that was because of the economic downturn, and it was so many states had more Medicaid recipients at that time, and yet their own budgets were in deep trouble, and so the federal government upped the matching rate. But now let's look at who would pay for the Medicaid expansion. For the first 3 years, the federal government will pay 100% of the expansion. And then in 2017, they pay 95%, Ohio pays 5%, and it continues to gradually climb just 1% a year up to 10% in 2020. But even then, from 2020 on, Ohio's cost stays at 10%, well below what we're paying right now for people that are on Medicaid in Ohio, and the federal government share remains at 90%. Next slide.
Yes.
And I think we're turning it over to Deb. Is that right?
Yep, that's right. So thanks, Kathleen, for a sort of review of the Medicaid program. So here in Ohio, when we move ahead with Medicaid expansion, it's going to be a rocket for our economy. It's going to create tens of thousands of jobs. I think the estimate's about 30,000 jobs or 29,000 jobs over a 6-year period. And those are direct jobs in healthcare. And it's going to promote a healthier Ohio. When people aren't relying on the emergency room as their only source of health coverage, we're going to be able to make sure people get the preventative medicine they need. Next slide. So the coalition, as Reverend Ahrens said before, is vast. There's many, many other organizations and groups than those pictured here. And it's been a lot of fun to work on this issue, and it's a very serious issue. So we have from unions to chambers of commerce, Ohio Right to Life, and Planned Parenthood. Everybody sees the win-win in Medicaid expansion. And, of course, our organization. And there are groups who oppose, and I'm pretty sure this is the full list of groups that oppose the issue, so that is why it's so important advocates are joining us tonight to be sure our voice is being heard on why this is a good program. So also, as Reverend Ahrens said earlier, the governor did introduce Medicaid expansion in his version of the budget. So the budget started February 4th, and he had included that in his version of the budget. Next slide. Unfortunately, it did not stay in the budget. So first, our state budget was in the House of Representatives. Then it moved over into the Senate, and then the budget kind of under the conference committee comes together. And we did a lot of work. We've made a good case. We had a good legislative visits, and unfortunately, it just didn't stay in the budget, so our work continues. Next slide. And it was very important as we got down to the wire that there was a piece of language in the budget that in some ways we thought was hopeful, but because they didn't keep it in the budget, they could have. If John Kasich hadn't line item vetoed some language, we would have been in a lot of trouble. And it's very good that advocates called our governor and encouraged him to do that line item veto so that we can continue this important fight for Medicaid expansion. So where we stand right now, our legislators have returned to their districts without passing Medicaid expansion. They could reconvene at any time, really, and get this done. The Ohio General Assembly has scheduled some hearings. Later we'll see a dispatch article that, good things are happening in the State House, but, we need to see this pass. And the state has said that they need about 6 months from when we greenlight this issue to be able to administrate the program. We're a little bit behind that point as our marketplace is going to open October 1st, but we remain steadfast that this issue has to see the light of day. And it's a big program of enrolling 275,000 new Ohioans to receive health insurance is going to take a little bit of time. So next, I think we're going to hear about one of these standalone pieces of legislation from Senator Cafaro.
Yes, thank you very much. Thank you again for including me in all of this. Can everyone hear me?
Yes.
Okay, great. Utilizing this iPad is something new for me. I'm now speaking into my iPad, so this is something new. I first want to just provide you with a little bit of context from my perspective. First of all, so you know, for those of you who are advocates that are on the call, know a little bit about me and my background. I actually come from a social service and healthcare policy background prior to being in the General Assembly, as well as concurrently while being in the General Assembly, pursuing my master's in social work. I have done everything from, again, doing direct work with older adults, needs assessment for county agencies, eligibility screening, inpatient discharges. I've been in the process currently with patient-centered medical home accreditation for family practices associated with Humility of Mary Health Partners in Northeastern Ohio. And I'm a certified benefit bank counselor, so I walk in many of your shoes, and I very much understand the real-life implications, both from a provider standpoint as well as a patient and beneficiary standpoint. I serve as the ranking member on the Senate Subcommittee of Medicaid and Finance, as well as the Medicaid Health and Human Services Standing Committee in Finance. Basically, and I want to commend everybody that's been a part of this discussion, because you've done an excellent job encapsulating the Medicaid program, its importance, its implications, and kind of the legislative steps that have or have not occurred up to this point. I do think that it's important to understand that as the budget was working its way through the Senate, there were a number of us that got together, Democrats and Republicans, Senate and House members, together to try to identify a way that we could find a compromise to address some of the concerns that have been voiced by the opponents of Medicaid expansion, and do it in a bipartisan, bicameral way. And the result of those discussions, the preliminary result of those discussions, was a bill called Senate Bill 145, the bill that myself and Senator Burke had introduced together, Senator Burke being a Republican from Marysville and the chairman of the Medicaid Subcommittee on Finance. Representatives Amstutz and Sykes in the House, again a Republican and a Democrat, basically introduced the exact same legislation, which essentially was a placeholder, trying to show that there was a bipartisan and bicameral commitment to the issue of Medicaid. Unfortunately, that proved not to be the case. We were supposed to start some drafting sessions at the beginning of July, and essentially all of those discussions had dissipated. And as a result of sort of the inaction that had occurred, starting in July, when we were hoping to actually really get some substantive work done, I continued to plug forward, and working with the Health Policy Institute of Ohio, a nonpartisan organization who has not taken official stand on Medicaid expansion, along with the Ohio State University John Glenn School. Myself and actually Senator Burke had asked them to basically crunch some numbers and identify if it was at all possible to cover more lives, serve more people through the Medicaid program, aka expansion, but at the same time slow the growth of spending associated with Medicaid without kicking people off. And the reason why we asked for this is because many of those opponents that you saw on that slide are part of, are trying to find excuses and reasons of why we need to be afraid of the possibility of extending coverage to new people. And part of the fear that they're trying to put out there is what happens if the federal government walks away. You may be familiar with the fact that obviously the federal government for the first few years of Medicaid expansion covers 100% of the cost, and then it goes down to a 90-10 split. So we ran the numbers to identify what would happen if it went down to 60-40 between the federal and the state government, which is the current federal-state Medicaid match. That is the premise for Senate Bill 166. I basically went out on my own and introduced the substitute bill of Senate Bill 145. What would have been our substitute bill is my standalone bill that deals with, that basically shows that we can cover more people for less money without kicking people off. We also provide legislative oversight in the program, as well as some programming surrounding workforce development. We do not link workforce eligibility with Medicaid eligibility. That is prohibited by the federal government. In Senate Bill 166, we also do explicitly appropriate $500 million, and we do explicitly speak to the coverage group, which is at 275,000 under 138% of federal poverty. And we also have what's called a circuit breaker, which again, if the federal government walks away, we are free of our obligation, even though we had proven that we can continue to cover these folks. Finally, I just want to say two very important things. One being that I think it's important for folks to know that we never explicitly in language in the legislature have to say the word expansion, have to say 275,000, have to say 138% of poverty. None of that needs to actually be said. The only thing that needs to happen for expansion to occur is for the General Assembly to create a fund, okay, basically to appropriate the money that we would get from the federal government. That's all. And that appropriation doesn't even have to have a number attached to it. So, and the members of the General Assembly know this, and this goes back to the lack of courage that we're seeing. One ask that I would have of the advocates is that we are holding these hearings that you heard about. The Medicaid subcommittee is traveling the state. We were in Columbus today. We will be up in Cleveland next Tuesday, and the following Tuesday we will be in Dayton. Now, it looks like we're doing stuff, but the reality is all we're doing is talk. There is absolutely no action, and here's the reason why. Subcommittees in the Senate do not have the ability to vote, to accept amendments, to accept substitute bills, or to accept a bill in general. So my ask to you is call the President of the Senate, Keith Faber, or the Chairman of the Senate Finance Committee, Scott Oelslager, and ask them to convene the Standing Full Committee on Senate Finance. That is the only way that we will be able to have hearings that will result in real legislative action, because the hearings we're having right now mean nothing. So in order to get something done, we need the Senate Finance Committee to convene, and it's nowhere on the schedule. I probably took up a little bit too much time. I appreciate your time, and I know that I've put a lot out there, and so I just, if you all have a pen or pencil handy, and I know Alyssa will give this to you again later, but rather than take up more time, you know, and get muddled with questions here on this iPad, please feel free to email me at Cafaro, C-A-S like Frank, A-R-O, at ohiosenate.gov, and Ohio Senate is all together. Let me know that you participated in this, this program, and we will email you some comprehensive information on Senate Bill 166, the bill draft, as well as a summary, as well as the supporting materials that, that show the fiscal results, as well as some of the policy changes that we hope would help improve health outcomes while containing costs. So please, again, we are happy to work with you one-on-one, provide you information, and I'm always available directly if you have any additional questions. Thank you again for your time and allowing me to participate.
Thanks, Senator Cafaro. That was really helpful kind of overview of all the steps that this legislation has gone through in both the House and the Senate, and really thank you for your dedicated work to it.
It is my pleasure and my solemn obligation to do so. Thank you.
Thanks. All right, we're going to continue on with what are the consequences of not expanding Medicaid here in Ohio, and Kathleen's going to continue to talk about this.
Yes, so when this marketplace opens on October 1st to begin to accept enrollment for insurance that's effective on January 1st, 2014, very low-income Ohioans won't have an affordable health care coverage option if Ohio does not pass the Medicaid expansion. In addition, we will lose federal funds, over $20 billion in 6 years, and it means a loss of 28,000 new jobs to Ohio. Next slide. You know, I'm not sure people realize how very difficult it is that, you know, the situation that people are going to face in October. So I thought I would illustrate it with an example. Loretta is a 60-year-old early retiree, not a voluntary retiree, but she was working in a company that closed, and now she's earning 20 hours. Excuse me, she's working 20 hours a week and making about $10 an hour, and ends up with about $900 a month. Now, if she could get a subsidy in the marketplace, her subsidy level with such a low income would be about 2%, and that's about $18 a month to get health coverage. And yet, Loretta is not eligible for a subsidy. Why? Because her income is under 100% of the federal poverty level. Remember what we talked about earlier in this presentation, that when Congress passed the Affordable Care Act, Congress planned for people below 138% of the poverty level to get Medicaid. And so they were not concerned about the fact that the very poor would not get subsidies because they would get Medicaid. But the Supreme Court changed all of that in June of 2012 when it basically accepted the Medicaid expansion but threw out the penalty, thus leaving it an option to the states as to whether they would expand Medicaid or not. So you think about this. This person, this fictional person, Loretta, at $900 a month, will not be able to get any coverage. If her income was about $950-something a month, she would then be above 100% of the poverty level, and she would be able to get a subsidy. Now, she could still shop in the exchange, but at $900 a month and 60 years old, the premium would be at least half of what her salary is, and so that would just be unrealistic. Next slide. Oh, okay. So go ahead.
Do you want to say anything else about that, Kathleen?
The only other thing I wanted to say was that the navigators and insurance brokers and people are going to be helping folks get enrolled come October 1, and what are they going to tell people like Loretta? I mean, they're going to say, they're going to only have one thing to say, and that is going to be write to your representative or your senator in the state legislature and ask them to pass the expansion. Because unfortunately at this point we don't have the expansion in place. Thank you, Alyssa.
Yeah, no problem. All right, and next we're going to transition into another poll question. Ultimately, as advocates, we really believe that no matter how this gets done, it's going to get done in Ohio because it's simply the right thing to do. So our question is, how do you think that Medicaid expansion will pass in Ohio? And the options are that the Ohio General Assembly will reconvene and pass it, or if the Ohio General Assembly doesn't take action, that the Governor Kasich will take some sort of administrative action, or there has been talk about taking this to a ballot initiative in which the voters will decide in November 2014 ballot issue. So please select your responses. Give you a few more seconds to do that. Then I'll close the polls and share the results. So it looks like 50% of you said you think it's going to go to the ballot, 30% think that Governor Kasich might have to take action on it, and about 20% saying that the Ohio General Assembly will get it done. All right, thanks for that. So now we're going to transition into Deb talking about actions that you can take in Ohio to help make Medicaid expansion a reality, in addition to the things Reverend Ahrens shared and Senator Cafaro shared. Let me unmute Deb. That might be helpful. There you go, Deb.
All right. So we're going to review what folks can do now to make this a reality, and the sooner the better. As Kathleen said, October 1st, people are going to start shopping for their health insurance options. So right now, folks can write a letter to the editor. Next slide. So this is actually a little picture of an article that might go into print tomorrow. It was online today. Great article, really deserves our response. Folks, send a letter to, and the Dispatch is not the only paper, especially folks from across the state. It's very good to do a timely response, so try to send a letter to the editor within a day or two of seeing an article that really hits the issue, and this example here is perfect. And Senator Cafaro was referring to this data earlier, that the cost of doing nothing is actually more expensive. And legislators need to hear from people who would benefit from Medicaid expansion. So we have our fictional character Loretta, and we've given you a lot of data, the direct jobs growth, but nobody really makes this point better than folks like Loretta. When he or she can come speak to a legislator as to why we need them to be a leader, be courageous if they need to be courageous, really helps cut through some of the charts and make the point that this is about people's lives. And when people are healthy, they're happier, more productive workers, and that's all a win-win. So I can talk about the facts and the facts and the facts, but we really need people's personal stories. And again, here's a list. So we have the letters to the editor, stories in the media go a long, long ways, visiting your legislator. They're in districts across the state right now, so if you happen to live in Akron or whatever, go ahead and meet them in Akron. I'm not going to make you come down to Columbus to talk to your legislator. There are community forums where we can talk about this issue. So tomorrow night here in Columbus, the organization that Reverend Ahrens is also involved in, B.R.E.A.D, is going to be hosting an event at 700 High Street in Worthington, and that starts at 7 p.m. at St. John's Episcopal Church. There's going to be another such event the following week here in the Columbus area. And if you're happen to be in Akron and you say we should do something like that, I totally agree with you, and get in touch with us. We can help you get the pieces together to help have a forum in your neighborhood. And it doesn't need to be in a church, any community forum, a meeting at the library, to help make sure people are educated about this issue. And so here, on to Alyssa. We have a poll up. We're wondering what you would be able to commit to do this summer in supporting Medicaid expansion. So the first option is attend a B.R.E.A.D event. Your second here is call or email or visit your legislator. Maybe you personally could share a story, writing a letter, or something else. And again, we're hoping that you can do this within the month of August. So people scroll through, click an option, and then Alyssa will come back on here and tell us what people clicked.
And there is that other option. So if you want to do something that Reverend Ahrens mentioned or something that Senator Cafaro mentioned, you can click other and then just type what you're going to do into the comment box, and who knows, we might come up with other ideas that we hadn't thought of ways to get involved and to be an advocate for Medicaid expansion. So a few people have clicked other. So if you did click other, just type in the message box what you're interested in doing, and we'll share that with everyone. Give you a few more seconds. And I will close the poll and share its results. Looks like lots of people want to get involved, calling, emailing, visiting their legislators. That's really great. We really want to keep the pressure up. Looks like the next one is writing a letter to the editor. That's really a great article. The link is in the PowerPoint that we'll send out to you in an email tomorrow. And if you need some help writing that letter to the editor, we'll be able to help you. Contact Deborah, and we can get you a guide and walk you through some steps on how to do it. And attending that B.R.E.A.D event, again, it's tomorrow in Worthington at 7 p.m. If you're interested, we can get you some more details about that. It looks like another option for some people who said other said community organizing. We know we have some really strong communities here in Ohio, and doing some community organization around Medicaid expansion is always welcomed and a great idea. Thanks for that, Mark. So now we're really going to open it up for any questions people have. So I will take Deb and Kathleen off mute, so you're both off mute. And if you have any questions, please submit them in the questions box. See if we have any yet.
Maybe while we're waiting for a question, we can just mention that the B.R.E.A.D event tomorrow is at 700 North High Street in Worthington. Don't go to 700 North High Street in Columbus or you'll end up downtown, and this is in Worthington. It starts at 7 p.m. It's at the Episcopal Church at 161, on High Street at 161.
Okay, looks like we have a hand raised from Mark Stansberry. I will unmute you, and you can feel free to ask your question. Go ahead, Mark. Or if you can't figure out your speakers, because it looks like you're on your computer, feel free to type your question, and I can ask it to our presenters as well. Okay, Mark's question was, when comparing Medicaid expansion versus Medicaid reform, how do we address the difference between expansion and just doing reform?
Well, that's an excellent question, Mark, and I think that what we have to remember is that some of the reform ideas that are in the legislation that's been presented are good ideas. I mean, there's some, in fact, there's even in the Senate Bill 145, there's some language that looks like it would pay for peer review, or not peer review, but peer counseling that's often done, that's often been found to be the most effective kind of counseling for people with substance use disorders. So, you know, there's a lot of emphasis on making sure people have case management, that care is properly managed. So there's nothing wrong with reform, but what we have to remember is that that without the expansion, we're still going to see 275,000 Ohioans who have no access to care at all. So the two really have to go hand in hand. And I think that while we may, when we talk to legislators, if their issue is mainly that we need to reform Medicaid, I like to point out the fact that under the current governor, the Office of Health Transformation has already done amazing things to reform Medicaid, expanding health homes, moving more care into the community instead of long-term care in institutions, just to name a couple. I hope that helps answer the question.
Okay, great, thanks. If you have any questions that maybe this presentation brought up, or maybe something we didn't cover, something you've seen in the news, in the newspaper about Medicaid expansion, feel free to type that into the comment section on the toolbar, on the GoToWebinar toolbar. If you don't see the toolbar, there's a little red arrow that expands and minimizes the toolbar in the upper right-hand corner of your screen. If you click that, it will expand it. You can type in your comment question. I'll be able to see it and read the question to our presenters. If we don't get any in the next minute or so, we'll conclude this webinar and thank everyone for participating. So get those questions in. Do you have any last remarks that you'd like to share, Kathleen or Deb?
Yeah, I just do want to bring up just one other quick kind of hot item of news, actually, that we saw in the paper today, and it's not good news. Apparently, Representative Sears is now being challenged in a primary because of her support for the Medicaid expansion. And of the Republicans in the House, she's certainly been one of the most courageous, or I would say the most courageous, on this Medicaid expansion issue. So she's up in the Toledo area. It's actually Monclova Township. It's northwest Ohio. And I'm hoping that people will just be aware of that, and when they have the opportunity, to thank Representative Sears for her continuing support and urge her not to back down now that she's being faced with this primary challenge.
And I'll close with saying, we're not where we wanted to be yet in this issue, but if folks hadn't taken action and encouraged on our governor to do that line item veto, we would be in a very different spot right now. So I'm working towards beyond hopeful that this can happen. It has to happen. And if people start seeing some petitions circulating, do not assume that we have to wait till fall of 2014. I'm hoping that we can get this done before then, and there is the chance that when legislators see some petition booklets going around, they'll get inspired to get back into the State House and do the right thing. So nobody give up, even if you happen to see a booklet circulating. We're hoping that's just one more tool in the toolbox to get this done.
And just so people know, there is no current effort. So if you were to be handed a petition tomorrow, it wouldn't be the petition that you might think it is. There's discussion of doing a ballot issue. People are thinking about it, looking at it, but at this point, no official action has been taken.
That's right. And all I'm saying is if any action goes in that direction, it doesn't mean that our legislators can't step in the State House and still do the right thing.
Okay, great. So we'll make sure to get this presentation out to everyone who participated in the webinar. We also have a recording of this webinar that we will post up on our website, as well as send out in the email version that I send out to you tomorrow. On our website, we have a Medicaid Expansion Center that's updated with information about what's going on, studies from HPIO, things like that. It's a great resource, a great tool with presentations, other materials that you can use as you're organizing around Medicaid expansion in Ohio. Also, to get the latest news, we manage Ohio and support Medicaid expansion on Facebook. Go ahead and like that page, and we post news articles, upcoming events, things that are happening statewide to support the effort. So go ahead and like Ohio and support Medicaid expansion on Facebook. Also, if you'd like to see email updates in your inbox, you can join our email list. You can either visit that link, or I have a poll that you can just simply click yes, you'd like to be added to our email list. Just click yes, you'd like to be added to OCHC's email list. If you're already receiving our emails, great. That's wonderful. This is mainly for new people who haven't had a chance to be added to our email list yet. Go ahead and click yes, and I will make sure you're added to our email list as soon as possible. And so you can start getting action alerts and news and all the things that we're doing and our partners are doing to help support Medicaid expansion in Ohio. So thanks for doing that. And finally, I really just want to thank all of our presenters, Kathleen, Deb, Senator Cafaro, and Reverend Tim Ahrens, for participating in our webinar today. Here is our contact information. I will also include the email address for Senator Cafaro and Reverend Tim Ahrens' email address in the follow-up email. Just want to thank you all for taking time to participate, all of the participants in the audience today, for supporting Medicaid expansion in Ohio, and really taking the time out of your evening when I'm sure you had a million other things you could have done to learn more about this important issue. Like I said, I will be sending out a follow-up email with links, important information, lists of ways that you can get involved, the information about the B.R.E.A.D event happening tomorrow night. And if you have any questions kind of overall about Medicaid expansion, go ahead and contact Deb Steele at dsteele@ucanohio.org. So with that, we just want to thank everyone for being here again tonight, and this concludes our webinar. Have a great night.